Hi, my name is Paula Denny, and my research question is whether or not transracially adopted individuals who suffer from depression that is directly related to trauma that is correlated to their transracial adoption and or upbringing would benefit from cognitive behavioral health therapy that is paired with EMDR counseling treatment. A transracially adopted individual is any individual who has been adopted by a individual or family that belongs to a different race than the adopted individual does biologically. Because of this, they face a unique upbringing where they do not fully identify with either their biological family, nor do they fully identify with their adopted family due to the differences that make up who they are, both culturally and racially. Because of this, they may have unique issues that arise and that require specialized treatment due to issues that they may face as a direct result of their very specific situation. The hypothesis is that those who receive transracially adopted individuals who receive EMDR treatment paired with cognitive behavioral health therapy to treat depression that is associated with trauma that is correlated directly to their adoption and or upbringing would have significantly reduced depression than those who do not. The null hypothesis is, of course, that there is no correlation between depression and trauma associated with transracially adopted individuals, and therefore EMDR treatment and paired with cognitive behavioral health therapy would not have a significant effect on individuals who are transracially adopted. The study design would take place in a counseling center with individuals who are already receiving counseling treatment or choose to participate in counseling treatment. This would be a randomized study, as in the only requirements would be that there are 100 volunteers, all of whom are transracially adopted, all of whom are at least 13 years of age, both male and female, no specific age categories, no specific number of each gender, just 100 transracially adopted individuals, at least 13 years of age, who express suffering from depression that is believed to be associated with trauma that is related to their adoption and or upbringing. These individuals would be split into two groups of 50. The first group of 50 individuals would receive treatment from a cognitive behavioral health therapist who would only provide cognitive behavioral health therapy. The second group of 50 individuals would be treated by a cognitive behavioral health therapist who is certified and trained in EMDR and would also be treated with EMDR alongside cognitive behavioral health therapy. The inventory that is chosen to be used as a tool is the Beck Depression Inventory. This inventory has high validity, high reliability, and great retestability. It has been used for several decades and is still used today by several therapists, clinicians, and facilities, and that is why it was selected. I will include the references regarding my studies surrounding the Beck inventory, as well as my studies surrounding the need for specialized counseling for transracially adopted individuals and treating depression through trauma through specialized methods. As I continue on, the instrument would be provided to these participants before therapy begins regarding the study. So before they start the study, they would individuals in both groups would participate in the Beck Depression Inventory. Then 3 months into treatment, and then finally at the end of the study, which will be 6 months, they will take it again once more. The proposed statistical analysis is that the individuals who received cognitive behavioral health therapy paired with EMDR would have significantly reduced symptoms of depression as compared to those who only had the cognitive behavioral health therapy without the specialized treatment of EMDR focusing on trauma-related issues. This is thought to be because of the depression is related specifically to trauma that impacts transracially adopted individuals. Therefore, the EMDR should have a much more significant effect on the individuals than the individuals who are not receiving EMDR to treat their trauma-related depression. Thank you.